So today's question is 15-year-old female presented with recurrent infections by catalase positive organisms. What is your diagnosis? Okay. So yesterday we saw about Chidak-Higashi syndrome, which is due to defective phagolysosome fusion. Okay. Sorry, Chidak-Higashi syndrome. Okay. So this is due to defective phagolysosome fusion. So this cat to understand the infection by catalase positive and catalase negative, you need to understand the basis. So I was telling the cellular events of inflammation, you have margination, rolling, adhesion, transmigration, chemotaxis and all. So Chidak-Higashi was due to defective phagocytosis and phagolysosome fusion. So when you see this disease which I'm going to discuss today, this is due to defective killing mechanism. So when you want to kill a microbe, your cell needs to generate free radicals. Okay, so that's how your cell is going to kill the microbe. So how do you generate your free radical? So it involves a lot of enzymatic reactions. Your oxygen will be converted to superoxide by NADPH oxidase. Then your superoxide will be converted to hydrogen peroxide by superoxide dismutase. Hydrogen peroxide will be converted into hypochlorous acid, which is a potent microbicidal, by myeloperoxidase. Okay. So this catalase is an antioxidant which can convert your hydrogen peroxide to water. So defect in any of these can lead to defective killing. So if you don't have NADPH oxidase, what happens? You get something called chronic granulomatous disease. The patient will have recurrent granulomatous inflammation in various parts of the body. If you have superoxide dismutase, what happens? Again, there is some problem with free radicals. So you can get a disease called amyotrophic lateral sclerosis. Okay. Especially you have different variants of superoxide dismutase. So you can have amyotrophic lateral sclerosis. It's a type of motor neuron disease. Similarly, if you have myeloperoxidase deficiency, we call myeloperoxidase deficiency. So now let's come to catalase positive and catalase negative organism. What do you mean by catalase positive organisms? Those microorganisms which can produce an enzyme called catalase, we call it catalase positive. Those which cannot produce, we call it as catalase negative. So can you give any example for catalase negative organisms? Your streptococcus is a catalase negative organism. Suppose, let's imagine the patient is having deficiency in this enzyme. So the patient is going to get chronic granulomatous disease. Okay. So now let us imagine the patient is having this NADPH oxidase deficiency. So what is so special about catalase negative organisms is, like streptococcus, they can produce hydrogen peroxide by themselves, by their own mechanism. So let us imagine two patients. One patient is having NADPH oxidase deficiency. Another patient is having myeloperoxidase deficiency. You don't know which patient is having what deficiency. So you expose both the patients to catalase positive and catalase negative organism. So what happens in this case, in this patient, in catalase negative organisms? So this is going to produce hydrogen peroxide, and this can be converted by MPO into HOCl. So catalase negative organisms can be killed even though you have deficiency of NADPH oxidase in case of chronic granulomatous disease. So patients with this enzyme deficiency are more prone to infection by catalase positive organism, because catalase negative organisms can be killed because they can generate hydrogen peroxide. Now come to this patient. When you're going to expose a patient with MPO deficiency to both catalase positive and negative organism, what happens? Even though your catalase negative organisms can produce hydrogen peroxide, you don't have MPO to produce HOCl. So patients with MPO deficiency can get infection by both catalase positive and negative organisms. Okay. Now the question is infection by catalase positive organisms. So your answer is chronic granulomatous disease. In MPO you can get infection by both. Bruton's A-gamma globulinemia, it indicates absence of gamma globulin. Your B cell precursors do not mature into mature B cells. So if you don't have mature B cells, you don't have plasma cells, you don't have immunoglobulin. So these patients are more prone to develop infection by giardia, and this is due to defect in Bruton's tyrosine kinase enzyme. Thank you.